Knee replacement surgery. The biggest advantage of doing it with robotic technology is that its planning should be perfect. And it is necessary for us to do a CT scan for every patient before the surgery. We enter the CT scan into our laptop a day before the surgery. We enter it. These contains all the pictures of the patient's knee. That is how the femur bone and tibia bone are. What the situation of the joint is, it is already available on our computer. It comes from the CT scan planner. We look at the patient's knee joint, the joint that will be inserted, its size. We can plan its shape and design. How well that joint will fit. HTI will not be too big or too small. And how well it will provide comfort to the patient while walking. If we do all this plan through the CT scan, we extract this plan made from the CT scan onto a pen drive and introduce it into the robot. The next day, when we perform the surgery in the morning, exactly what we planned on the computer, the robot helps to conduct the surgery based on that plan.